I'm Kelly, a student in the Radiographic Anatomy and Positioning 3 class. We get about 1,500 hours of hands-on experience in hospital clinical settings. Anatomy and positioning courses give us a deep understanding of human anatomy while learning the positioning of all parts of the human body. We learn anatomical landmarks and positioning lines and planes that help us accurately position our patients. Our lab, located next to our classroom, is the part of this class where we practice what we learn, with instant feedback from instructors while we practice positioning before we work on real patients. Because our lab is energized, we're able to blend theory-based knowledge of the science behind creating an X-ray with proper radiation protection. This hands-on practice ensures that we're clinically competent and ready to start our careers in any hospital setting.